The second acid-base imbalance we're going to talk about is respiratory alkalosis. So the lab values you're going to see here are high pH and a low PaCO2. So remember, a high pH indicates base or alkalosis, and a low CO2 because CO2 equals acid. So if I'm alkaline, I have less CO2. Now, while it's always possible, it's relatively rare to see a significant hypoxemia with respiratory alkalosis because it usually means the patient's breathing really fast or really deep, but they can only keep that up for so long. So make sure that you're still generally watching those oxygenation levels. So because we know that high CO2 levels equal acidosis, we can reasonably deduce that a low CO2 or a loss of CO2 would cause a respiratory alkalosis. The most common cause is hyperventilation. That could be too fast, or it could be too deep, or both. Now let's use that same pressure release valve analogy from respiratory acidosis. Except in this case, the pressure release valve on the water heater is stuck open. So all the steam is just constantly coming out. If that's the case, you're never going to be able to actually heat your water. Well, in this case, all the CO2 is escaping because of this increased respiratory rate and this hyperventilation. And therefore, it's impossible to get a good acid-base balance. Now, this crazy breathing pattern could be due to anxiety, could be due to fear, could even be something like pain or even a fever, but it's making them breathe faster or deeper than they normally would. Now, remember that it could also be the body compensating for a metabolic acidosis. Remember, compensation is when the opposite system tries to compensate. So if I have a metabolic acidosis, my body's going to try to create a respiratory alkalosis in order to compensate. And of course, sometimes we can go a little too far. Now, my body might also be compensating for a little bit of hypoxemia, breathing a little faster to try to get more oxygen in and therefore unintentionally blowing off too much CO2. Now, the other thing that could cause a respiratory alkalosis is mechanical ventilation if we have set their respiratory rate too high or if their tidal volumes are set too high, because that means they're going to be blowing off way too much of their CO2. Fortunately, that is an easy fix. We just turn the rate or the volume back down. So again, we're going to see signs and symptoms of whatever the cause was of the respiratory alkalosis. The patient may tell you straight up, I'm really anxious, or you may see tachycardia and a fever. Either way, you're going to see signs of the cause. You may even look at your ventilator and realize that it's set at a rate of 30 with huge tidal volumes. So once we see the signs of the cause, the other thing we'll see is signs of the alkalosis itself. So lightheadedness, numbness and tingling, shortness of breath, even some chest discomfort. And then, of course, we're going to have some confusion as well because the brain is very sensitive to changes in pH and CO2 levels. Now, listen, if any of you have ever hyperventilated, then you probably know what this feels like. I remember one time when I was in middle school, I was crying so hard. I think I'd slammed my hand on a door or something, and I was hyperventilating from the pain. I remember getting really lightheaded, and the next thing I remember, my mom was waking me up and picking me up off the ground because I had passed out. Luckily, when I passed out, I stopped freaking out enough to start breathing normally, and my CO2 levels leveled off enough for me to wake back up. But think about someone who can't seem to stop hyperventilating, or someone who has some sort of underlying process making them hyperventilate. Eventually, their body is going to give out. They can't do this high and fast breathing rate for very long, right? So they're going to end up exhausted and they'll be unable to protect their own airway. So we've got to keep an eye on these patients. So the number one thing that we're going to do for a patient with respiratory alkalosis is fix whatever is causing it. If it's anxiety or fear or a fever, we're going to treat that. We can reassure them, make sure they know they're safe, or we can even try the paper bag trick. Now, this is something that is not a permanent treatment. It's not a permanent fix, but really what it does is it basically helps keep them from passing out. So if this is the patient and they're breathing out, it's a great drawing, guys. Breathing out into this paper bag, then all their CO2 is being trapped in here, right? So then when they breathe back in, whoop, they're breathing that CO2 back in. So it keeps their CO2 levels from dropping too low. So it's certainly not a permanent fix. It's not a miracle cure, but it will keep them from losing consciousness. Now, we also want to address any ventilator settings that might be a little wonky. Make sure you're checking with your facility and your respiratory therapist. In most cases, the respiratory therapist is the only one who's allowed to adjust the ventilator settings, but you can certainly call your RT and talk to them about it and see what they think. As a last resort, if we can't get someone to calm down or slow their breathing, we'll use medications, maybe benzodiazepines, just to help them relax a little. Again, it's all about trying to fix the cause of the alkalosis. Priority nursing concepts for a patient with respiratory alkalosis are going to be acid-base balance, gas exchange, and oxygenation. Remember, the hyperventilation could be due to hypoxia, or it could cause the patient to tire out and eventually, therefore, become a breathing and oxygenation issue. So make sure that you're keeping an eye on that. So remember that lab values for respiratory alkalosis are a high pH and a low PaCO2. It's most commonly caused by some form of hyperventilation for one reason or another, including anxiety, fear, could be compensation for hypoxemia or even metabolic acidosis, or mechanical ventilator settings could just be inappropriate. You're going to see the symptoms of the cause, the symptoms of the alkalosis, including lightheadedness, shortness of breath, or confusion. And it's also possible that you might see some hypokalemia because of the alkalosis, but it's much less common with respiratory alkalosis. And then, of course, we're going to make sure that we treat the cause, decrease their anxiety, get that respiratory rate down, and correct any vent settings that are inappropriate. All right, so make sure you check out all of the resources attached to this lesson and check out the next 2 lessons for the metabolic source acid-base imbalances. Now go out and be your best selves today. And as always, happy nursing.